Hi, this is Tori from Low Country Herald Magazine. Today we are at Murray Community Medical Clinic, and I am with Angela Robinson, the Executive Director of the clinic, and Reverend Judith Knox of the church where the clinic is housed. Okay, Reverend Knox, tell us about the church and the clinic.
Murray United Methodist Church is a church that has a rich history in the Jedburgh, Somerville community. The church is 152 years old, and the church has been a pillar of the community and has been a place where people have come to worship, and also have been a place where people have come to meet other needs that they've had in their life as well. The medical clinic is opened once a month, and we have services here for individuals to come in for medical care, but we also have a component of the medical clinic that is involved in preventing illnesses. We offer exercise, education on diet and wellness, in overall wellness.
That sounds great. And what made you decide to offer your services free?
Well, we started back in 2007, and since we were out in the community since then, we've hosted various health events here at church and in the community. And one of the questions that we would hear, this is great, we're receiving free items from different vendors, we're able to speak with physicians to ask questions, but the question that kept recurring was, but what if we don't have health insurance? How can we be seen and evaluated by a physician? And so from receiving that feedback from the community, we went out and decided, let's try to offer those services as well to the community.
Wow, yeah, because that's a huge problem for a lot of people. Since you have begun this, how many people in the community have you served?
Over 250.
Wow, really?
Yes.
That's wonderful, and it's not. And honestly,
Yes, ma'am, you're right.
Yes.
You're absolutely right.
Now, I see that you do blood work and lab work here. Is there a doctor on staff?
We always have a physician in the office whenever we are open. Our medical director is Dr. Adam Mendel, and he is an ER physician over at Roper.
Oh.
And we also have at least 30 different RNs, nurses who volunteer with us.
Okay.
We have a host of medical assistants that are certified. We have some phlebotomists. We have a host of other medical and non-medical staff on our team.
Good. How difficult was it for you to partner with others in the community to offer services like your free prescription services or lab work?
Lab work, it was not hard at all. It was a very easy process. We contacted LabCorp America and let them know what we were trying to do to help those without insurance, and they gladly accepted our request, and they provide all of our blood processing free of charge to our patients.
Oh, that's nice. Okay, this is kind of a tough question. In your opinion,
Yes.
what would need to happen for a free clinic like yours to not have to exist?
A lot.
Yes.
A lot would need to happen. I would actually call out to different physicians, especially our specialty physicians, and see how we can incorporate free medical visits in their actual office, because some of our patients actually work, but their employer does not offer health insurance.
Right.
And so that's one of the gaps that we're trying to close that gap in healthcare in that area. Another thing that we definitely need help and assistance in is actually prescription assistance. So if some of the pharmaceutical companies can actually offer more free medication programs to the community, then maybe our clinic would not have to exist.
And that would be great.
That would
wouldn't
be.
it? One other thing I wanted to ask you is, do you offer anything like a mental counseling or mental health issues that I know you see come in here also?
We see mental health issues that come through, and unfortunately we are unable to help in that area. That is an area that we are struggling with to recruit different medical offices to help us in that area, but also there is trouble getting help in that area, not only from staff but just from our own government.
Right.
So that's just an area that I'm open to any suggestions on how to help those patients, because we do see those patients.
Okay, all right. And my last question, since you do have to exist, would you like to see this expanded to other communities?
Absolutely, because we have patients that travel from St. George to come down to this area, and that's about a 30, 45-minute drive.
Yeah.
We have patients that come from downtown Charleston. So I would love for communities like this to exist throughout the community, the Tri-County, not just in Somerville, Charleston. And not only that, my hope and one of my inspirations is to have these free clinics that do exist linked together, because there are some free clinics out there that offer other services that, for example, we don't. It would be wonderful if we could link with them so that we can still help those in the community together.
So you would offer like a referral service if you couldn't offer something, you could tell people where to go that would offer that.
Absolutely.
That would be a great idea. Let's jump on that. Maybe we can get something going. Okay, Angela, Reverend Knox, thank you so much for joining us today. And you will see this in the October issue, Low Country Herald magazine.
Thank you.